I was seeing a lot of acne when I was a GP, a lot of patients with acne. And one of the things I found really frustrating was how limited we were in the treatment options we could offer. All I could give people who were coming to see me was antibiotic prescriptions. Around my mid-20s, I was thinking about there wasn't anyone doing what I wanted. I didn't want really invasive treatments or solutions. I wanted sort of a plan for aging well. 10 years ago, if I talked about probiotic to help somebody's skin, that seemed really strange. My approach is about more than just aesthetic. For a lot of people, it just stops at the surface levels.
Today's guest is not just an aesthetic doctor, she's a holistic aesthetic doctor. Dr. Rabia Malik, based at the Harrods Wellness Clinic, specializes in a lesser-known but incredibly powerful part of medical aesthetics, skin rejuvenation. Her approach is all about aging beautifully and naturally without injectables. Instead, she focuses on restoring skin health from within, using collagen stimulation, evidence-based skincare, and a belief in treating the whole person, not just the surface.
I really believe in collagen banking. I encourage all my patients to really take care of their collagen because we all start to lose collagen in our skin from our early to mid-20s onwards. Kris Jenner, from the pictures that I'd seen, she does look amazing. But is that attainable or realistic for the majority of people? Probably not.
She has over 20 years of medical and industry experience and is the founder of her own skincare line. This conversation is about long-term results, doing less, and redefining what it means to care for your skin. Dr. Rabia, you started off your journey as actually a GP. How did you go from being a GP to coming into medical aesthetics?
So for me, I did all my general practice training here in the UK. I went to King's, I did medical school, and then worked through general practice training and, love family medicine. And I still really enjoy that. But along the way, I sort of developed, I think I've always had an interest in skin and products and, skin rejuvenation in particular. But I was seeing a lot of acne when I was a GP, a lot of patients with acne. And one of the things I found really frustrating was how limited we were in the treatment options we could offer. So I remember thinking, all I could give people who were coming to see me, particularly in the context of the NHS, was antibiotic prescriptions. And I knew that there was so much more if I could talk to them about lifestyle and products and things they could put on their skin. And then also, what they were eating and their diet. I felt like I could help people get a much better result. But in the context of NHS general practice, I felt really limited in terms of what I could do. So for me, it was really combining this interest in, a more holistic approach, thinking about things beyond just what we could prescribe, that led me to set up my own private practice that was really skin focused. And then I think also for me, around my mid-20s, I was thinking about treatments and products for myself and my friends. And I just realized there wasn't anyone doing what I wanted. I didn't want really invasive treatments or solutions. I wanted sort of a plan for aging well. And I wanted, advice that was rooted in science and evidence-based. So I think really my whole journey into aesthetics started from a personal interest and also my experience in general practice. And that's sort of how I ended up starting practice. And it's now been just over 15 years since I started the skin clinic alongside my general practice work.
Being in the industry for 15 years, how do you think it's changed over the course of those 15 years?
Well, medicine has changed. Now our understanding of health and well-being has evolved. So I think, when I qualified as a doctor 20 years ago, we weren't really taught about gut health at all. It wasn't on people's radar. Even 10 years ago, if I talked about, a probiotic to help somebody's skin, that seemed really strange and unusual to a lot of people. And so I think what's really evolved is people's understanding of health and in particular things like gut health, hormone health. And I think that access to information has also really evolved. So, we now have a lot of very educated consumers, patients who really come in asking for very specific things. But I think sometimes too much information can also be overwhelming. I think there's a lot of confusion in the industry. People don't know what's right for them. And I think that can be difficult for a lot of people. So I think, the big changes are sort of our understanding, access and exposure to information, and then, of course, the whole world of social media, which wasn't really around when I first started. And I'd seen, how that's had an impact on aesthetics and also what people are looking for. The sort of aesthetic ideals are very much influenced by social media and celebrity culture. So there's been lots of changes, and I think it keeps evolving. But for me, the really exciting thing is that in the world of aesthetics, there's always new things coming to market. There's always a lot of innovation, and that's exciting. So I definitely enjoy that. But as the world changes, so does aesthetic medicine. It's a reflection of society as well.
In terms of the way the industry is right now, what does aging well and aging beautifully mean to you?
Yeah, so to me, aging well is really about taking a long-term approach and looking at things from the inside out. I personally am not interested in just quick fixes because in my experience, you don't get great long-term results. And I think aging well is really about having a plan. I think it's about having confidence as well, in yourself and also in sort of what you are committing to. So I think it's, understanding why you're making the choices that you make and then sticking with them over a long period of time. I think it's actually about maintaining the character in your face, but, looking the best that you can possibly look, but also feeling your best. I think the two go hand in hand.
You mentioned that you're not actually an aesthetic doctor, you're specifically a holistic aesthetic doctor. What does that mean?
So for me, I think the reason I refer to myself as a holistic aesthetic doctor is because it really just emphasizes that my approach is about more than just aesthetics, which, for a lot of people, it just stops at the surface level. So you're just thinking about the surface of the skin. And for me, where the way I practice and having a more holistic approach means that I'm very much looking at optimizing internal health. And so it is incorporating, so helping people optimize your gut health, hormone health, lifestyle, so that they are looking and feeling good as they progress. And for me, it's all of that. It's not just skin or surface level how you look. It's everything. And actually, how you look in your skin is really a reflection of your internal health. So for me, I think you can't get great results unless you fix what's going on the inside.
So me, as someone who's just turned 26 quite recently, I'm starting to think about how I would like to go forward aging,
Yes.
from looking after my skin. So what do you suggest? Where do I even start to look for what I should be doing?
I think that for you at this stage, it's all about prevention. I wouldn't rush into doing too much too soon. I think that protecting your skin barrier, getting into a good skincare routine doesn't necessarily mean a 10-step skincare routine, but just having the right products with the right ingredients, using sun protection every day, just getting into good habits, avoiding things that we know damage our skin and damage our skin's collagen. So smoking, vaping, staying away from things like that. And just having a good, balanced lifestyle. I think those are all things that I would recommend that you invest in now and get into good routines, good habits that will set you up for kind of good results later on. And then in terms of treatments and I really believe in collagen banking. I encourage all my patients to really take care of their collagen because we all start to lose collagen in our skin from our early to mid-20s onwards. So this is a time where you want to prevent loss of collagen and you want to maintain the levels in your skin. So just having a program, a plan that you can stick with and finding a doctor or an expert that you can work with or follow who shares the same approach as you. I think that's really important.
Collagen banking, what kind of treatments would I do to make sure that I'm collagen banking?
So collagen banking treatments are treatments that stimulate collagen in the skin. And collagen banking as a whole is about preserving your skin's collagen and then stimulating new collagen formation. And probably one of the most effective and underrated treatments is microneedling. So I think that's something that you could start with. You don't need to do it all the time, but it's definitely something you could consider adding it to your regime.
So, Botox and filler are two of the most popular medical aesthetics treatments. Why do you think that is?
Because they get great, quick results for people. And I think in this day and age, that's what people want to see. They want the quick fix. Um, and Botox has its place. I personally don't advocate filler at all. As I said, I believe in stimulating, maintaining your own collagen levels. And unfortunately, I think the issue with injectables in general, particularly in the UK, is that they are poorly regulated and often overdone, and sadly often done by people who are very young, probably before they need them. And so if you start really young, you end up having a lot of treatment by the time you get to your mid 30s, 40s, and you can get changes in your natural facial contours which start to look strange and can actually be aging. So my whole sort of point with Botox and filler is that it may have its place for certain people to help address certain issues, but you have to do the right treatment at the right time. And you need to have a trusted expert who can guide you with that, and someone who's trained and really a medical doctor who knows what they're doing to help guide you.
So, in this day and age, people tend to go to social media to look for their aesthetic doctor, aesthetic practitioner,
Right.
but that isn't necessarily the best way to go about it. Like, for example, yourself, you've built an amazing, loyal customer base purely through your skill. So, how can we kind of change that narrative? And what can we do differently to make sure that people don't just look at people's social media following and actually take into account people's skill?
Yeah, I think it's hard for the average person on the street because, of course, we're all looking at Instagram and social media. It's the first thing people tend to look at when they're deciding whether or not to go and see a SEN doctor or practitioner. So I totally understand. It can be tricky, but I always say to people, look at their qualifications, their experience, how many years they've been doing aesthetics or what other training they've had. I think with injectables, you can actually be certified to inject someone with Botox or filler after a one-day course. And in my opinion, that's not enough to have the experience to inject somebody. I think you need more time to develop your skills. And so people need to ask the right questions. You need to sort of look at what the doctor's done, where they've trained, who they've worked with before. I always think it's safer to see a doctor who's based in a group practice where there's a team, because that way there's other people around if something goes wrong or if they need support. And I think that that's also how doctors learn and get better at their craft and their skill. Going to a group practice or a team is always a good starting point, and just trying to get a better idea of qualifications and experience. I think that's important. But really, I think it's very important to have a consultation before you have any treatment, and to ask the questions and to sort of get a feel for whether that doctor has the same approach as you. And if you feel that they're advocating what you're looking for, then hopefully it'll be a good fit.
Currently, beauty standards that we see on social media, what are your thoughts on what is kind of portrayed out there for what the results are for medical aesthetics?
Look, I think the beauty standards are constantly evolving, and that's just a reflection of society. But I think a lot of what we see on social media, it's often particularly with celebrities or people in the public eye, that's their full-time job. So it's a very big commitment. They're doing a lot of treatments. They have a lot of things going on. So it takes a lot to maintain a certain appearance. And that may not be realistic for you or, the average person on the street, just because, a lot of people won't have the time or the money, the resources to be able to invest in that way. So I think you need to be careful about kind of what you're comparing yourself to. Um, and I think, I think we all need to be realistic about what is attainable and what we're trying to achieve, because not everything we see in social media or in the public eye is necessarily what it seems.
Speaking of celebrities, there's been a viral video going around of Kris Jenner, who's actually 69 years old, and she's got a facelift and she looks potentially 20 years younger. What are your thoughts on that?
Well, look, I mean, I think each to their own. And I think, Kris Jenner, from the pictures that I'd seen, she does look amazing. But is being 30 years younger, is that attainable or realistic for the majority of people? Probably not. So I think we also have to be careful about what we're, comparing ourselves to, as I said before, because that may not be realistic. That's a lot of work and a lot of other treatments and a lot of support, nutritional, lifestyle, products, supplements. It's a lot of things. It's not just one, big surgery. And even that procedure will probably involve a number of stages and a number of different treatments. She looks great, and I think that's great for her. I just think we have to be careful about what comparing ourselves to, people in the public eye, and understanding that what they're investing is, that it's their full-time job. And it may not be for a lot of other people. So I think you just have to have perspective. And also, is it really something that we want to be aiming for? Should women who are in their 70s be aiming to look 30 years younger? I mean, I actually think that I want to look like the best version of myself. But I'm 45. I'm not necessarily trying to look like I'm 25. I'm happy with where I'm at. It raises a lot of questions about what we're all trying to achieve. And I think everyone has to come to their own conclusion.
In terms of what we're trying to achieve, I think that's such an interesting point, because sometimes on social media, when we see results of certain medical aesthetic treatments, surgical and non-surgical, everyone is kind of going for the same nose or the same lips. But speaking from a personal point of view, coming from Asian heritage, I probably naturally just cannot get that nose. So what are your thoughts on people trying to achieve a certain look or look a certain way at a certain age?
Yeah. Well, I think that's one of the unfortunate things in medical aesthetics, because I personally don't believe that we should all look the same. And I think it's about maximizing your own personal features and maintaining the character in your face. I don't think aesthetics should be about changing your face or giving everybody, a particular look, because, these trends change and evolve. So, at one point in time, a certain sort of look, big lips, big cheeks might be, fashionable, but maybe it won't be in a few years' time. And then you're stuck with something that maybe you don't want anymore. So I think it's quite hard. Like, a lot of these procedures are not 100% reversible. So I think they have to be, taken seriously and done judiciously, and done with a long-term view. I think that's the thing sometimes people forget, particularly if they're starting to have treatments very young. You have to think about the long-term impact on your face, and how that's going to look and how you're going to age and evolve. So I am personally not a fan of everyone looking the same. I think it's about looking like the best version of yourself, but also feeling like the best version of yourself. I don't think it's just about the look. I think it's about the internal element as well.
I actually had a conversation with a friend the other day, and we were talking about medical aesthetics, and I said to her, oh, you do get some procedures, and she said, oh, actually, no, I don't get injectables, I just get polynucleotides and hydrofacials. Then I was thinking about yourself, and I was thinking, you are an aesthetic doctor, you don't actually do injectables, you specifically focus on skin rejuvenation. So I would love to know how you define that to someone, that actually is like a part of medical aesthetics.
Yeah. So, I mean, look, I am definitely very niche in my practice because I choose not to work with, injectables like Botox and fillers. So the focus of my practice is really regenerative aesthetics. And I think I've been doing that for the past 15 years. And now we just more clearly define it. But regenerative aesthetics is really about, stimulating your body's own cellular regeneration, stimulating collagen production, and working with your body and biology, so that you are just making the most of the processes that happen in our bodies anyway. So we're just harnessing them, I suppose, aesthetic purposes, but really to rejuvenate, maintain healthy, youthful skin. So the result of that is that really the focus of my practice is maintaining skin tone, texture, and skin quality, and helping people with certain skin issues that can be improved by optimizing internal health. So a lot of inflammatory skin issues like acne, rosacea, psoriasis, and then pigmentation. So I have, as we sort of discussed, a very holistic approach to dealing with all of these skin concerns. But regenerative aesthetic medicine is really about stimulating your body's own natural rejuvenation processes. And I think treatments like polynucleotides, exosomes, microneedling, and medical grade skincare, all of these things can really help to get great results. So it's not just about Botox and filler. I think, of course, those are the treatments that people most commonly associate with aesthetic medicine, but there's a lot more to it. And actually, for me, a lot of my work is the consulting side, is really helping people figure out what they need to do to optimize their internal health and to help them create a plan for the long term so that they can sort of age well over time.
You said that people will be maintaining their youthful skin, or actually they'll, like, the process of collagen stimulation in the body will be able to keep going. Can people expect then to have the same skin they had at the age of 25 at like 35 then?
Look, I think if you are proactive and you can prevent a lot of signs of skin aging, can certainly delay their appearance by avoiding certain things. So, for example, sun damage, exposure to toxins like cigarette smoking, vaping, avoiding those things, and then using certain other things like sun protection, medical grade skincare, certain stimulating, rejuvenating treatments like microneedling that we've touched on. You can certainly delay the signs of skin aging and, maybe even reduce their occurrence to a certain extent. But, aging in itself is a cellular process. So inevitably we are all aging. It's just about aging well and, aging the best way possible. I don't believe in trying to sort of live forever. But of course, we want to maintain ourselves. It's actually about being able to be completely, fit, active, and healthy, look good and feel good, and be active as we get older. And I don't think you would want one without the other. I wouldn't want to look, 30 years younger than I am if I didn't feel that way, or if I didn't have the physical capability to do the things that I used to be able to do. So I think it's everything. It's really, I feel now people's understanding, perception has shifted, and our understanding within medicine has also evolved. So now the emphasis really is on prevention, maintenance, and longevity.
You mentioned that lifestyle is so important with also coming and doing these treatments. What would be the case if someone was to do one or the other? Meaning, for example, just get the treatments, but then not look after themselves so much.
Well, look, I mean, the treatments can only do so much. So they will help, but you won't get the best results unless you invest in sort of having a healthy lifestyle. And that's the bottom line, because you can't make up for like a really bad diet, too much alcohol, smoking, all of that stuff over time catches up with you. I think when you're young, your body's regenerative ability is better and you can probably get away with it more. But as we get older, I think these things do catch up with us. So I think the best results are from looking at all of these things, having treatments, using the right product, having a healthy, balanced lifestyle. I think that's how you get the best results. There's no quick fix. It's really the long-term approach.
I've had a few people say to me that the word polynucleotides and the word exosomes sounds like a scary chemical. And the funny thing is, I know it's quite like a non-invasive treatment. So how would you describe it to someone who thinks it's a scary chemical?
Well, I mean, look, they're two different things, but they're both treatments, polynucleotides and exosomes, work on rejuvenating skin cells. So they both work in slightly different ways, but they are the cornerstone of regenerative aesthetic medicine, in my opinion. And I think they will take over because they really stimulate cellular function and they switch on a lot of cells and a lot of mechanisms of action in our bodies that tell our bodies to act in a more youthful way, to make more collagen, stimulate new skin cells. And so I think you get really good results. Now, in the UK, generally speaking, exosomes are not, well, in the UK and the US, exosomes should not be injected. That's the current guidance. So these are usually microneedled into the skin, and we get great results with that. Polynucleotides can be injected or put into the skin with microneedling. So I personally do my protocols with microneedling, and we get really good results. But there's so many combination treatments now as well. So I think it's just finding the right treatment and the right practitioner for you.
I would love to know a patient's story that you found particularly interesting or one that you remember.
There's so many, I feel some of the most, for me, positive parts of my work are helping people where they've maybe had an issue, a skill issue for a really long time. And acne, of course, is obviously such a difficult one for so many people. But, I've had young women in their sort of 20s where they've had acne for years. They've had Roaccutane, they've had all sorts of really aggressive medication, and it's still come back. And then to really be able to help them with a more holistic approach has been really rewarding because we've actually fixed the underlying issue. And, for the person that I'm thinking of, it was really sorting out her gut and her hormones. And I think that even though it took time, the end result was really worth it. And that's always really satisfying. And then, sadly, I've seen a lot of women in their 40s go through big life changes, whether that's divorce or, loss of loved ones. And sometimes that can take a real toll on your skin. And I think sometimes women in their 40s, they've spent years taking care of their children or families, and they've neglected themselves. So trying to sort of help them get some time back for themselves, invest in their skin, in themselves, and to see their confidence come back is also, really rewarding. I think skin is so tied into how you feel about yourself. So I love being able to help people, feel better about themselves by improving their skin.
That's exactly what I think about medical aesthetics, as it's a part of self-care and almost your routine. Speaking of women in their 40s who actually, have been through difficult situations, I was thinking of like even younger women who maybe work more or like just are focused more in their careers or even just in general. Thinking about how we are going to also maintain our confidence and how we feel, how we look is super important. So speaking about where to start, like if someone's to start out about thinking about this, where would their journey begin?
I always say to people, start simple. Start with the simple things. And I think just have a good skincare routine. So for me, that just means start with cleansing twice a day and use sun protection. And once you're doing that, then the next step is adding in a serum. So serums have a high concentration of active ingredients, and depending on what your specific concerns are, there are serums for everything. But I would just start with that very basic routine of cleanser, serum, and then sun protection. And often your sun protection will double up as a moisturizer. And it really depends on your skin type and what you're trying to address as to, the types of products. But those are the kind of fundamentals that I think are really important. And then I think once you've started with that, I think about your day-to-day life, what you're eating, how active you are, your sleep, because that has a huge impact on your skin and also just on your general health. And try and just get into good habits of, sleeping, drinking plenty of water, getting antioxidants in your diet, getting essential fatty acids in your diet, and just kind of building all of that up. And there's so much information out there. So, a lot of the basic things, I talk about all the time on my social media, on my website, in my group. I have a membership group as well. So, there's so much information out there, but just find someone whose approach you like and follow them, and they will share a lot of their tips with you, I'm sure. And then if you feel like you're ready to have a consultation, then there's so many doctors who you could consult with to help you create a plan. And then I think when it comes to treatments, I think less is more. So start with, just getting the basics right and then build up from there slowly. You don't need to rush into having tons of treatment.
Amazing. Well, thank you so much, Dr. Rabia. Thank you for answering all these amazing questions and for joining us today.
My pleasure. It's lovely to spend some time with you, and I hope that is helpful.
Amazing. Thank you.